This is Call the Psychiatrist, the show where psychiatrists answer your questions. I'm Dr. David Handley.
And I'm Dr. Abby Snavely.
On today's episode, we have a listener who wants to get back into therapy and has questions about how to find the best fit.
Say you like me, you better count the ways.
Yeah, I think we've got a great question today.
Yeah, I'm excited.
Yeah, this is something that comes up a lot, I think, for friends, colleagues. I think it can feel pretty overwhelming to try to find a therapist given all the different credentials, the different techniques that are out there.
And just like people are different and weird, including therapists and the potential patients.
Yeah, that's true.
I mean, right?
Are you one of those? Are you one of the weird ones?
Yeah, I'm a weird patient and a weird therapist. But, lucky enough, there's a lot of fish in the sea. It's still possible.
Oh, good. It's a great reframe.
Yeah. Right? Every pot has a lid. I don't know. My grandma would say. But before we dive into it, do you need to do your legal mumbo jumbo?
Of course I do. Otherwise,
okay, please.
Otherwise, we'll be sued
I'm going to take a nap.
So.
All right.
Listening to this podcast does not mean we have a doctor-patient relationship. Our intention is to educate and entertain you. Nothing we say is intended or recommended as a substitute for medical advice, diagnosis, or treatment. Always seek the advice of your own physician or other qualified health professional regarding any medical questions or conditions. Was that faster?
It was articulate. I don't know. I kind of spaced out. It seemed fun.
Understandably.
Yeah.
Okay.
Yeah.
All right.
I've heard it. I, for one, have listened to every episode of this podcast.
All the way to the end, I hope.
All the way to the end.
Unlike some
That's
of you out there.
It's not directed at anybody in particular just because we don't get those kinds of stats.
All right. So our question comes from Susan. I emailed Susan back after the first question. I wanted a little more information. So I've put those two questions together. So here we go. I've listened to a few episodes of your podcast. I like how you balance the historical perspective with current events. I especially liked your discussion on The Shrink Next Door. I did some therapy in college, but did not have a great experience. I never connected in the way you describe with my therapist. Because of some trauma, I'm interested in starting therapy again and want to do better this time around. When in college in therapy, I never felt like we got to the source of the issue. Instead, we worked on strategies like breathing, meditation, and time management. It was all about technique. Now I want to try to resolve these issues by digging deeper and understanding why I'm always so anxious. I'm a perfectionist and often stressed out. I think I'd like a different type of therapy. I'd like help in understanding how to choose a good therapist, and how do I know what is a good match? So here's a number of questions. From your perspective, what should I look for in a therapist? What should I do to prepare for my first meeting? How many visits does it take to form a good relationship with your therapist? How do I know if I'm in the right place? How much money should I budget? And how long does therapy take? There's a lot there.
Yeah. But I think there's like two big ideas. One is that Susan here is very clear that she's looking for a different kind of therapist and the goodness of fit question. I think we can get into the money and logistics stuff at the end, but at least in terms of the discussion, I think those are the two big areas.
Before we jump into that first big idea, I want to acknowledge just how vulnerable most people feel when they start therapy, which I think helps explain why this process of finding somebody can feel so difficult for people. One of my lecturers in medical school was this older eccentric psychologist who warned all of us soon-to-be doctors that the psychiatric examination was the most intimate and invasive exam we would ever do. He had a good point. I mean, he got a bit grandiose about it. That something like no matter what orifices we may probe or physical pain we may inflict, that it would pale in comparison to the discomfort that a patient can feel when exposing their psyche. So that always stuck with me. And I've definitely found that. And I've tried to be empathic for that process for people. I have to tell you, this guy was extremely eccentric. He's the only guy I know that he wore the same suit every day. And he actually wore a cape, like a dress cape.
Oh.
Yeah, and carried a cane, but not for support, just to loft it about.
Just for like panache or something.
Yeah, right. It was fancy.
I respect that.
Yeah,
Did he have a monocle?
He could have pulled that off well.
Yeah, sure. But he had restraint, obviously.
I ended up doing a rotation with that guy, a week-long thing. Uh-huh. He was actually one of the reasons I did not go into psychiatry from medical school. So, but entertaining. I've got lots of stories about that guy, but anyway.
I bet you do. Well, so Michael Weisberg used to stand in front of the class every year and tell all the general medical students. and tell them that they all became doctors because they were traumatized and they just needed to get used to that idea. He's like, you just have to understand the reason you want to help people is because you couldn't help somebody in your past. And, I'm not saying he was wrong, but it was really unsettling to these super high achieving MS1 or 2s or whenever he was teaching it. He was also a character, though. He didn't require costumes, I think.
Yeah, there is a lot of truth in that.
No, he's not wrong.
Yeah.
But people would just be ruffled, to say the least.
So let's start talking about that first big idea about just picking a different kind of therapy. And I wanted to point out or repeat something that you pointed out last episode 6, that we have hundreds of studies showing that the alliance between the patient and the therapist is the single most important predictor of success in therapy. And so it's more important than the type of therapy or the therapist's theoretical orientation. And so it's not to say that those other things aren't also important, but it suggests that you've got to have a good relationship with your therapist to get the best outcome. So on one hand, we could just say, well, it doesn't really matter as long as you have a therapeutic alliance. But obviously, Susan has had experience with one kind of approach, and she's interested in trying something different. I think there's these big categories for types of therapy. And this may sound a little bit reductionistic. And maybe I'm even being a little bit arbitrary, but I think it could be helpful. I think it could be helpful for Susan. I think it's helpful. And I talk to patients in this way. There's some types of therapy that are very prescriptive. They're structured. There's a lot of activity on the part of the therapist. The wording I use, which I don't think you have always liked it when I characterized it this way, is that these therapies are a bit top down. And what I mean is that there's somewhat less emphasis on understanding why a person's experiencing some kind of symptom, at least in the beginning of the treatment. And I think of these therapies as very here and now, in the moment, and they can be very helpful. So, for example, if someone is having multiple panic attacks a day, or worsening insomnia or severe depression, and they're thinking about hurting themselves, I think these approaches are incredibly useful. If someone comes to me with multiple panic attacks a day and I start to steer us into hours of conversation about a breakup 14 years ago, I don't think I would be being as helpful as I could be. And so I think in this approach, in this large category, I'm talking about things like cognitive behavioral therapy, dialectical behavior therapy, acceptance commitment therapy, solution-focused therapy, mindfulness-based therapy, and just to name even a few of them.
I'm fine with that characterization, and I think we'll come to this too, maybe later, but I think you're also just speaking to meeting a person where they're at. If someone needs techniques to make it through the day, have distress tolerance, things like that, that's incredibly helpful. Absolutely. And if someone comes and says, I need help with panic attacks, and you think that you want to talk about a relationship from 14 years ago, then this is where that maybe the two big points meet. Like, that's not a good therapeutic relationship.
Yeah. And then the other big category of therapy, and this is what we've been talking about on this show, is really focused on the relationship between the patient and the therapist, the relationship the patient's had with other people throughout their life. There's an emphasis on development, events in childhood. And I think, using a broader term, we could call these insight-oriented approaches. And there's an effort to understand why a person may act the way they do in a certain situation. It's a bit more of an origin story. The patient may understand a different kind of narrative about their life that they can use to make changes. But, here's the thing about this kind of therapy is having insight into your problem isn't always enough to change behavior. Somebody may be in their fourth terrible abusive relationship and know exactly how they got there, why they got there, and still not be able to break the pattern. But then for other people, having insight is enough. And there's this important idea that if we can observe something deeply enough, it'll change as a result of the observation. And so just in general, paying attention to things can sometimes actually help you change them.
Or at the very least, I think it's an important first step, right? Like, how could you possibly change something if you don't know what's happening or have any clue as to why?
Yeah, I guess it depends on what you're addressing. I mean, there are changes you can make without understanding why.
Yeah, okay. All right. As I said, I think that's fine. But I think, sometimes I will have patients say to me, okay, yeah, I get it. I see it. Here's the pattern. Like, what am I supposed to do? And I think that what am I supposed to do is actually a pretty important question. But I still am going to maintain that you have to know what the problem is, at least define the problem or be able to identify it as a preliminary step, at the very least, to making any kind of change.
Yeah, I agree with you. I mean, I think you have to both agree what the problem is, but do you think you have to know? Do you have to have the more complex explanation as to how you arrived at that
No.
problem?
No, not necessarily. I will revise that. I prefer the more complex explanation,
Right.
but sometimes, well, I mean, you can accuse me of whatever you think that indicts me of, but I think that there is something, I don't know, and maybe it's that we get, the symptoms under control for now, and then later we understand why. Sometimes I actually even think the why is not about change. I think the why can also be a way to give someone credit for doing the best they can, for saying, like, there must be an emotional logic to this thing that doesn't follow traditional logic. And instead of blaming yourself or saying that you're crazy or messed up or whatever your mother used to accuse you of being, that maybe there's a good reason why you're doing what you're doing. And we just have to give you forgiveness or grace in that moment before either we go deeper in understanding or really go about fixing it. Because I think often people think that they're going to like guilt or shame themselves into changing. Like, if I just call myself an idiot enough for continuing to get in these bad relationships, then it would change.
Yeah. I wish that worked.
Right? Oh my God, I'd be healed.
I don't have anything to indict you over. I'm not sure what that comment was.
No, I don't know. I'm just teasing you. I'm just trying to get you riled up.
But you did. I think you did get to the point.
I misspoke.
Okay. You also then got to the point that I wanted to make for Susan, which is
okay. Sorry.
No, I don't think this is an either or. We're describing the either or, but actually, I think what Susan needs is a both and, like to somebody who is well rounded in both of these approaches. So from the question, I think she's interested in insight, that type of therapy,
yes.
Looking at the origin of her problems.
Mm-hmm.
And so I think when she's trying to get a therapist, she needs to find somebody who has some reasonable training in a type of therapy from both of those camps, because she's interested in the origin, but I think a well-rounded therapist would be important. Also, kind of on this topic, one thing I would tell her and I would tell anybody is that you need to avoid people that are sectarian. I mean, I think whether you're looking for a therapist or you're joining a group on Facebook, you need to avoid those extremes, those rigid philosophies. Cults just don't really work long-term. It's the old, if you have a hammer, everything's a nail.
Yeah. I mean, if your guru is promising a solution to all of your problems, of course that's appealing, but just probably not very realistic. Even if your guru is Dave Hanley.
Right. If you could be so lucky.
Right.
If you find
it's an
out
exclusive glove.
If you find out that your therapist does EMDR, that's the eye movement desensitization and reprocessing, with 90% of their patients, you can probably bet that they're going to offer you EMDR. And the same thing is if you've got somebody who's a well-known expert in CBT, you're probably going to be offered CBT. And so I think Susan, can ask and try to find somebody who has both. For other listeners out there, they may have very different goals, or you may know that you prefer one of these approaches over the other. So if you have OCD, then you need a therapist who's really well-versed in exposure therapy. Or if you have panic disorder or social anxiety, you may prefer somebody who's going to offer a more structured approach with CBT. So if you have a preference, that's of course fine. And if you don't, I think having the availability of both types of approaches is going to be probably the best fit.
Sometimes trying the specific therapy recommended for your specific problem, I think is a great place to start, like what you're mentioning. But I know that a lot of analysts would say that social anxiety is a great thing to analyze, for example. Or maybe you do ERP for OCD and that gets you so far. And then, the next step could be insight-oriented, which is almost what Susan is describing. I don't know how helpful that therapy was that she had in college. I don't think she really said. But sometimes these things can be complementary or stepwise. Sometimes you can do them with the same person and sometimes you can't. But it sounds like for her next step, she might be looking for someone who talks about relational therapy, psychodynamics therapy, something like that, or just even insight-oriented, like you said. If they're looking at like a Psychology Today post or a website or something, those would be buzzwords I would look for.
Yeah, I agree with you. Yeah, in my own practice, I'm not as structured and regimented with, say, CBT. Unless that's what the
Right.
patient is wanting. Like if they come in and I want 8 to 12 sessions of CBT for my insomnia and I don't want to focus on anything else, like, okay, we can do that. One reason
Yeah,
I
and
don't,
that's worth a shot.
yeah, and one reason I don't do the more regimented or manualized approach is because patients say they want the homework and everything, but then they don't really do it. So it's like there's resistance
Right.
there around that. And I'm like, well, I think to be helpful, we should probably incorporate some of these other ideas.
I think that's right. I don't know if you've come across the analogy. Hopefully it doesn't sound like it's setting up a hierarchy, but in terms of how deep you want something, it's like, well, CBT or those such things are kind of like a microwave. If something's there and you just need it warmed up, that's okay. But a microwave's not going to be able to pull off a complex stew. For that, you need an oven and a lot of time, or I guess a stovetop and a lot of time.
I have not heard that. I'm sure the
I like it.
I'm sure the CBT therapist out there would have a lot to say about that, but I don't have anything.
Right. But if you're like, I can zap your business in 8 to 12 sessions, like that is a different approach.
Yeah.
And to me, it speaks to depth as well. Like, how deep does somebody want to go? Both the therapist and the patient.
Well, right. I guess to me, it speaks to doing the right thing at the right time for the right person.
If your stew's done, put it in the microwave. Sometimes you're just hungry.
This metaphor is getting a little carried away.
Okay, fine.
But yeah, okay. No, I follow that.
Okay, save me from my metaphor.
I think that you want your therapist to have enough training that they can change their tact if things aren't going well.
I think that's right.
If things are going really well with one approach and now you're ready to do something different, I think those are all really good things. But not everybody, as you said, it's patient preference, it's therapist preference, but not everybody needs to be making a stew because you're just going to make them worse before they get better. And that's not going to be consistent with their own goals. And so again, that's the personalization of it all. Yeah. Okay, so now let's talk about some just other practical considerations. And this will get to some of Susan's specific questions. I think the first thing, this is an easy one, I would look for somebody who's licensed. If it's not apparent on their website or when you book your appointment, you can ask about that. And then decide if the gender of the therapist is important to you. It probably doesn't matter if we had a huge sample size, but if it matters to you, then it's probably important. And so you should look for somebody with that gender. Have you ever, there's been times when I'll get towards the end of a good therapy and I wonder what it would have been like for the patient if the person's therapist had been a different gender. Like, the transference would have been different. And so how might that have evolved? Like, do you ever think about that, or is that?
I do think about that. And I mean, maybe that's kind of I could see how that would be like a tricky recommendation to make. But sometimes if I'm even talking to friends or something like that, being able to say, last time you did it with a man, like maybe next time a woman would just be different or give you a different experience. I think that's important. Like on one hand, if let's say you have trouble trusting men, so you've been seeing female therapists, and maybe you get better and do a piece of work, have a break, then maybe the next frontier, within limits, you still have to feel comfortable enough, would be getting in a therapeutic relationship with a man where you could test that out. I don't know. In my own therapy once, we were, when I was with a male therapist, we were at some terrible impasse and he made a comment that he thought maybe I would do better with a woman. And I kind of got furious and said, how dare you? I've turned you into my mother so many times. I just don't see how that would help. But anyway.
I think that's really interesting. I guess what I was wondering, and you've answered it there in the anecdote, was sometimes I think about, okay, if the transference was that, I was the brother that didn't suicide, or I was the father that finally had this unconditional regard for the patient, what would that have been like with a female therapist? And you're just saying, maybe it doesn't matter. Maybe the gender really just doesn't matter and the transference is going to be the same.
But I think that can be true, definitely. I mean, which is why I told the story and I stand by what I said. But at the same time, I think, when we're talking to someone like Susan or anybody seeking therapy, like you said, it's vulnerable. I always think, to your point about empathy too, that if someone is calling me, somebody's calling a psychiatrist or a therapist, it's not because things are awesome. right? Like people are coming really in their time of need because they're having trouble. And, when you're trying to go by whatever information you can gather and whatever clues there are, if someone's gender helps you feel comfortable, then use that. Great, right? Like you can kind of use everything on your side going in to make your best guess. But, maybe if you're striking out with therapists of your desired gender just because of availability or whatever, maybe, you can take heart and think about being flexible if that seems at all possible.
Yeah, and I guess if you find yourself with somebody and you wish that they were maybe a different gender, bring that up. Talk about that. Bring it into the therapy. So there'd be something useful there too.
Right.
So let's get into some other practical things. Maybe going through the process of actually setting up an appointment. So some therapists, especially in private practice, will offer you a phone call before you get that initial appointment. So the call is designed for each of you to see if there's a chance for a good fit. The therapists, they don't want to schedule you if they don't think they can be helpful. I mean, hopefully. And they also want to have some estimation of the intensity of the treatment. They got to make sure that basically they can not just get you in their schedule for that initial appointment, but if they think that this is going to take weekly appointments for the next 9 months, they may or may not have that kind of capability. And so that's something that they might be looking for as well. But in that phone call, that's a good time for you to ask about their theoretical approach. And then also at the end of the phone call that you decide how you felt in the conversation. I mean, I don't think there's anything specific that you need to do except to see whether you felt comfortable enough to actually meet them face to face.
Yeah, I think that's right. There may be specific answers you're looking for in terms of have they had experience with X symptom or what's their availability, how do they approach different things. But like you're saying, it's almost more the process, the vibe, how it feels to talk to that person. And to a certain extent, like, do you like them or trust them or think they have a chance of being helpful? And if you do, then that's probably, again, a decent indication to at least move forward and, meet in person or meet online and see what it's actually like.
Yeah. If you don't get the phone call and then your first meeting is going to be face to face, then again, I think that intuition is going to be the most important thing. I think you need to ask yourself, do you feel like they listened to you? Do you feel like they were caring and understanding? Did you discuss goals that you have for treatment? And I think it's important if the therapist asks you how the meeting went. I mean, it may come up just spontaneously in the conversation, but that's something that should be openly discussed. And if the therapist doesn't bring it up, I would encourage you to bring it up just to see how the therapist responds. I see this as a great indicator that the therapist is actually interested in the alliance with you and they're comfortable talking about the relationship as it's developing. And I would say this, I think, particularly for Susan, I think these are some tips I think that she can really zero in on in terms of assessing that person's availability for what she's looking for.
So to your point about intuition, I think that is really valuable. But for example, if you are someone who frequently has issues of trust or, has a hard time warming up to people, when Susan says, how long does it take to make a good relationship with someone? I think some of it is about how long does it take you as a person to make a good relationship with people? If you don't trust anybody, then looking for a therapist you trust may not be the best marker. And for some people, maybe they want to have several conversations on the phone to kind of see how the different people fall out and then maybe schedule a couple of appointments and go from there. But some of it is also paying attention to yourself and how you approach people and approach different situations, to put your intuition in context.
And to that question about how long should it take, I mean, I think for a lot of people, just a couple of sessions is enough to evaluate that. But as you're saying, for other people, that might take a lot longer. I think questions that you could ask even after those session or two is, does this feel collaborative? Do I feel cared for? Do I feel like I can disclose uncomfortable feelings or events that have happened to me? And I think those are things you can dial in on. And then also watch out for boundary crossings that may be uncomfortable. I mouthed off in an earlier episode that if you know more about your therapist than they know about you after a couple of sessions, that might be a problem. But I think anything that might be going on, certainly talk about it. But if it's already happening in the first few sessions, I think that might be an indication that it's not going to work out long term.
If part of what you're taking into your first or second session is a bunch of information about their personal life, that just might be difficult. It doesn't mean it's insurmountable, but again, I guess I'm sort of interested in people having as much trust and as much comfort as they can going in, realizing that it's never going to be perfect.
Yeah. Her question, how long does therapy take? That one really depends. Again, if you're doing a structured kind of therapy, like with CBT, then that's going to be less time. That could be 8, 12 sessions. If someone wants to understand how is my low self-esteem negatively impacted all my relationships through the last 5 decades, that's going to take a little bit more time. And part of the reason it will take more time is because it's important that things are paced out a little bit. Like, this is hard work for the patient.
Yeah, dude.
And it may mean that they need to take things a little bit slower so they don't get so overwhelmed. So they can actually incorporate this insight that they're gaining so they can start making some changes in their life. If you just hand somebody over everything as if you knew it from the beginning, I don't think they can make as much use of that.
Yeah, I mean, I think that's right. And I think that, we've probably said this before, but generally speaking, people come to us with really difficult problems, right? If they could solve it, they could solve it by reading self-help or talking to their friends or following conventional wisdom, then they would have. And on one hand, once a week might seem very frequent, and it could be like that could be plenty of an intensity for a person. But if it's like 45 or 50 minutes once a week, and then they go around living the rest of their life, it's a pretty small chunk of time. But in terms of both the pacing and matching the patient or meeting them where they're at, I think it's interesting. I might start a recommendation off to someone after the first few meetings and say, I really think it makes sense for us to meet really frequently. And they might say, great, like once a month, once every few months, and I'm thinking once a week or multiple times a week. And, some of it is that person's frame of reference of what they think is important. But especially if someone's dealing with something intense, or I think that in order to make the changes they want, more intensity would be helpful, then, sometimes I think I would rather see someone twice a week for 10 weeks than once a week for 20. That, in terms of the pacing and intensity, again, it should be kind of a negotiation. But in order to make change, sometimes we have to turn up the heat sufficiently, but not too much. And that is a judgment call, but also something that can always be changed. It's not like you just sign up for a program and are stuck with it forever.
Yeah. Well, and also, I mean, there's structural issues that will get in the way. Like it may be that the patient wants to be there much more often, but because of cost and being able to leave their job for a doctor's appointment, I mean, all those things. So there's maybe an ideal, and then there's what you can actually accomplish. And I think that's okay to talk about. This is a good segue to Susan's question about cost. And, I think there's probably regional differences. I think this one's just hard to really know. I mean, it's going to cost more if you live in a place with a high cost of living than it is if you live in a place with low cost of living. There may be a difference in cost based on the credentials of your therapist. So a doctoral level therapist may charge more than a master's level therapist, but even that's not always the case. I mean, there's therapists with a social work background I know that charge more than I do, even if I'm doing a medical care. So sometimes that may be a decent rule of thumb, but you can find exceptions. And then maybe the last thing in terms of cost is if there's a third party payer involved. So it could be that your therapist is in network with your insurance, or if not, it may be that you can get some reimbursement from your insurance for those visits. So that would be a factor as well to check with your insurance company.
Yeah. So, Dave, I agree with everything that you've said. I think these are also things to bring up with your therapist. Sometimes a negotiation is possible. Sometimes they have a sliding fee. Sometimes they may have tips or tricks or ways to help you talk to your insurance company about that. I don't think that going through an insurance list is always great. They're often not accurate and have either dead or retired therapists on their lists. I think, again, you can always call, email, whatever, talk to somebody and just figure out what the cost is.
Yeah, one of the most common reasons I will slide a fee is so that we can accommodate the frequency of visits that I think is
Absolutely.
important. Yeah. So,
Right.
Well,
Right.
the last thing I wanted to bring up, and Susan didn't ask this in the question, but I thought it was maybe pertinent while we're on the topic, is around telehealth. Obviously, with the pandemic, this has become not just popular, but sometimes necessary in parts of the country. There are studies that show similar outcomes between a virtual video session compared to a face-to-face session. For me, I really like meeting somebody in person if it's possible, even if we're going to do virtual sessions in, ongoing.
Agreed.
The people that I've treated for a long time, I really don't notice a difference on the virtual versus face-to-face. But when somebody's new to me, it's not that it doesn't work. It's just, it takes me a lot longer to get to know them. I think there's just not as many cues or behaviors, especially if I'm trying to focus on our relationship. I don't get that necessarily over the virtual. So there's still a lot of power, but I wanted to say that if all you have as an option to you because of many, many things is virtual, I still think that's better than not doing anything. And then if you have the option of maybe having an in-person session, even just one or two, I think you'll get a lot of information there that you don't over a screen.
Yeah. Yeah. And I think that also goes both ways, right? You're right. I mean, I think behaviors, mannerisms, what somebody looks like, eye contact. And again, I'm sure there's more technical words for it, but like a vibe, like how does it feel to be with them? There's a lot of information that's nonverbal that could be helpful to both people. And like Dave said, I think maybe this is, I don't know. I don't know if selfish is quite the right word, but it's like if your therapist wants to meet you in person at least once and you can make that happen, like do it because they probably have a good reason.
Yeah. Yeah.
I think people sort of think I have gotten some pushback that people are like, oh, it's kind of ridiculous. I'm like, how about once? Just once.
And they'll do it usually?
I don't know. Yeah, usually people will do it, though. I mean, as a preface, I actually think that in the pandemic, I'm not a silver linings kind of person, but I actually think that a lot of mental health professionals got a lot more comfortable with telehealth, and I think that is ultimately good. I think we as a profession got a lot less stuffy about, the frame and meeting in person and what has to happen to make a therapy good or good enough. And so overall, I think that's good. I'm always joking when I'm having Zoom problems that I tried to pick a low-tech profession and then somehow I ended up here in the year of 2020, whatever. And I'm not saying that online relationships aren't real, but I think there can be something powerful in having a physical reference point even for how someone presents themselves. And again, going both ways. I mean, I've also seen things about people's houses and pets and I saw someone's underwear on Zoom this year. Like there's other insights that I've gotten online that I don't have in person. So maybe an actual hybrid model is the best.
Yeah.
But it has sometimes taken more pushing than I would have anticipated previously because before no one was asking for telehealth.
Yeah. All right, Susan. Well, I hope this helps.
Yeah. Good luck, Susan. It's possible. It takes both a lot of patience, but also a lot of self-trust when you're seeking out something that it sounds like you really want a deep, meaningful experience. Of course, you're going to take it seriously.
Well, for everybody else, you can leave us a question by email or an audio message at our website, callthepsychiatrist.com. You can follow us on Instagram and Facebook at Call the Psychiatrist. And if you've gotten any benefit from the show, we'd really appreciate it if you would leave a review on the platform you're using right now to listen to the show. All right, thanks. Take care.
Bye. Talk about it, talk about it, talk about it, talk about it. Right? There's like a synth, like do 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 do. I want you to take that out.
I was saying, am I supposed to leave that in? Or?
No, you're not. You're supposed to laugh though.
Okay.
You're supposed to get energized.